Now today we are going to talk about ischemic heart disease. This ischemic heart disease means there is a insufficiency of the coronary circulation. Insufficiency of coronary circulation and which is slow and progressive. Which is slow and progressive. Now why it occurs? It occurs as a result of atherosclerosis of large epicardial coronary arteries. As you can see, this is the normal one. This is the normal vessel. And this one is a atherosclerotic plaque. There's a yellowish color, which is nothing but the atherosclerotic plaque. Atherosclerotic plaque or deposition of cholesterol. Yellowish is a cholesterol. It's a deposition of cholesterol where it will get deposited in the large epicardial coronary arteries, and they are more prone for the vasospasm or vasoconstriction due to less amount of EDRF or endothelial derived relaxing factor or nitric oxide. So because of that, they are more prone for the vasospasm. As you can see here in the ischemic heart disease, what happens? There is a atherosclerosis of the large epicardial coronary arteries. They are more prone for the vasospasm because of less EDRF or nitric oxide. Angina pectoris. Angina pectoris is a strangulated chest or squeezing type of pain. There is a worst pain that patient has ever felt. Angina pectoris. There is a squeezing type of pain, chest tightness, and that's why in angina pectoris it is called as a strangulated chest. Means there is a insufficient blood flow to the heart muscle. Why? There is a fixed narrowing of the vessel, and that may cause angina. Angina pectoris, it is the chief symptom of ischemic heart disease. It's a chief symptom. We call it as a strangulated chest. Why? Insufficient blood flow to the heart muscle from fixed narrowing of the coronary vessels, and that may lead to the angina or chest pain. We call it as a strangulated chest. It is a chief symptom of the IHD or ischemic heart disease, or we can say that it's a clinical manifestation of the reversible MI. Now, chest pain in the angina, precordial in it is precordial in region. Precordial region is there, and it is sudden, severe, suffocating, and substernal in origin. Precordial pain location, where it is located. What is the location of the pain? Precordial pain, which is sudden, severe, suffocating, and substernal in origin. Below sternum or substernal in origin. And as you can see in this picture, it is radiated to the left arm, jaw region, and neck region. So this is the red area in which that there is a referred pain. There is a typical distribution of the referred pain where in the left arm, in the neck region, jaw region, and this pain is aggravated on the exertion. This pain is aggravated on exertion, and it is relieved by rest or by taking the tablet nitroglycerin. Now, what is the pathophysiology behind this? Angina pectoris or ischemic heart disease, it is the imbalance. There is an imbalance between oxygen supply and demand. There is an imbalance between oxygen supply and demand. Now, in which conditions there is a decreased oxygen supply, like coronary atherosclerosis that we have just seen, or if there is a vasospasm or thrombosis of the vessels, coronary vessels. So, in this condition, there is a decreased oxygen supply to the heart muscle or increased oxygen demand. Increased oxygen demand like hypertension, hypertrophic cardiomyopathy, and ventricular hypertrophy. In these conditions, there is increased oxygen demand. So, because of that, there is imbalance between oxygen supply and oxygen demand. So that results from inability of coronary blood flow to meet the metabolic demands of the myocardium due to fixed narrowing of vessels. What happens because of imbalance? There is an inability of coronary blood flow. That coronary blood flow is unable to meet metabolic demands of the myocardium due to fixed narrowing of the vessels. And this myocardial oxygen determined by the myocardial oxygen consumption, it is determined by the preload, which is nothing but the end diastolic volume, afterload, which is the peripheral vascular resistance, and heart rate. It is determined by preload, afterload, and heart rate. Now, as we have just seen, it is the imbalance between oxygen supply and oxygen demand. So in which case there is a decreased oxygen supply because of the vasospasm, fixed narrowing of the vessel or fixed stenosis or thrombosis, and increased oxygen consumption, increased heart rate, contractility, increased afterload or preload. So conditions like hypertension, hypertrophic cardiomyopathy, ventricular hypertrophy. In these conditions, there is increased oxygen consumption. So because of that increased oxygen demand and decreased oxygen supply, there is a pain occurs, and that is called as a angina pectoris. That is the strangulated chest. That is a strangulated chest. It is nothing but the ischemic heart disease, type of a ischemic heart disease. Now there are three types of angina pectoris. First is the stable angina or typical angina. Usually it is not associated with the plaque disruption. If this is a coronary vessel and somewhere there is a plaque, so this plaque is stable at one place. This plaque is stable at one place. The margin and the surface of the atherosclerotic plaque is smooth. It will not get disrupted. It will stable at one place. It will not disrupted, and the margin and the surface of the atherosclerotic plaque is smooth. And that's why the pain or chest pain is experienced during exercise or emotional excitement or whenever there is increased workload on the heart, and the pain will be relieved by rest. It is pain will be relieved by rest because there is decreased demand, or by taking the tablets like nitroglycerin, which is a vasodilator, which increases perfusion. So this is the stable angina, or it is called as the typical angina or exertional angina. The different types of angina pectoris: stable angina because that atherosclerotic plaque is stable at one place and margins and surface of the atherosclerotic plaque is smooth. Okay, and this type of pain can be experienced during the emotional excitement or during exercise because there is increased workload on the heart, so you will feel the pain. And after that, you will, if you are taking rest, that pain will be relieved because there is decrease demand, or by taking nitroglycerin, which is vasodilator, it will increases the perfusion. Then second type is the unstable or crescendo type of angina. Unstable or crescendo type of angina, it is caused by the acute plaque change. Acute plaque change means what happens in that, if this is a coronary vessel and somewhere this is the atherosclerotic plaque, and what this atherosclerotic plaque will do, there is a, it is associated with the plaque disruption. The margin and the surface of the plaque is not regular, it is irregular, it is abraded, so that circulating platelets will get deposited over here. Platelet will get attracted, it will get adhere and deposited over there, and after that there is a super added fibrin will also get stick over here, and it will cause the thrombus formation. It will cause the thrombus formation, and because of that, it is, there is a increased frequency, duration, and intensity. Chest pain will get increased of frequency, duration, and intensity. That pain may felt at a lower level of physical activity, or it may felt also at rest. It may experience during rest also. It is the warning sign for the acute MI, or it is called as the pre-infarction angina. It is called as the pre-infarction angina, which is the unstable or crescendo type of angina. It is caused by acute plaque change, or it is associated with the plaque disruption. The atherosclerotic plaque is not smooth. Regular margins surface is not smooth. It is irregular. It is abraded, so that circulating platelets will get deposited. There is a superadded fibrin and there is a formation of thrombus, and it is the warning sign of the acute MI or pre-infarction angina. The third type is the Prinzmetal variant angina. Prinzmetal is the name of scientist. Variant angina or vasospastic angina. It is purely vasospastic, caused by the coronary artery spasm. It is very rare and episodic in nature. It is unrelated to the physical activity, heart rate, or blood pressure. It is unrelated with the physical activity, heart rate, or blood pressure. It may or may not associated with the atherosclerotic plaque or deposition of cholesterol. It is relieved by taking vasodilators, nitroglycerin, and calcium channel blockers.